Good afternoon, everyone. Welcome, welcome, welcome. On behalf of the Board of Directors, representing the Sickle Cell Foundation, I am Savannah Warren. I am the CEO of the Sickle Cell Foundation of Palm Beach County and Treasure Coast, and I am delighted to have all of you here with us today. We are going to have an amazing conversation. I'd like to first say, you guys, do you all see the lady that's standing right here in the white shirt with the red design? You know, she can handle it. No, don't think I'm putting her on the spot. This lovely young lady is Miss Keely Taylor, and she is our host, and she has brought us to the conference today. Can we give a warm thank you to Miss Keely? Not only is Ms. Keely the host today, she is also the former secretary of the Sickle Cell Foundation, former treasurer of the Sickle Cell Foundation, former vice chair of the Sickle Cell Foundation, and former chairman of the board of the Sickle Cell Foundation. And a loyal and committed friend always to the Sickle Cell Foundation. Thank you so very much, Ms. Keely, for inviting us into this amazing space. I am very happy to be here. I'd like to take a moment to introduce my board chair, the lovely young lady that said our grace and helped set the tone for this afternoon, which Miss Miracle Wade is. And Ms. Lynn also coming on board. All right. So today, we are going to have a conversation. We wanted to have an environment that everyone felt comfortable to engage in. And I am so very fortunate to represent an organization that has served the Sickle Cell community for over 50 years, more than 50 years. And I have friends and people that I love and that love me back that I call. And without hesitation, I said, I need you. And they showed up and they're ready to engage. And so I would like to first introduce our MC of this afternoon, and that is my very good friend, Ms. Demetria Moore. I can say so much about Demetria, and I will be here all day, but I know that I have to look at the time. I'm the reason she's MCing because I will go on and on and on. But she's a veteran. She's a community advocate. She is someone that cares about people, and she has an amazing publication that she produces every year called "And then there were 12." There's a significance to the number 12, and that publication is geared towards celebrating Black men in our community that have done amazing things, and they're from every walk of life. And she celebrates them annually, and this year she just did her 10th publication. So congratulations to you, Ms. Demetria. Want to bring down my panelists, and then I'm going to turn the microphone over to Ms. Demetria. But I just wanted to introduce the panelists because I want to say thank you to each of them for coming down and joining us today. You should see short bios of them on the back of the programs that you have. The first, let's start with Dr. Debbie. Bring Dr. Debbie down. Dr. Debbie is she's also a friend of the Sickle Cell Foundation, and she represents a very small community of professionals that look like her. I'm going to allow her to say her own thing, and they'll each have a minute to introduce themselves. But Dr. Debbie is our specialist. Paul. Come on down, Paul from Pfizer. Pfizer actually helped to sponsor today's event. So can we give Paul Paul is another one that comes through each and every time. Some of you may or may not know our senator, but the senator representing this very area, Senator Bobby Powell Jr. is back at the table with a hamburger. I think. Oh, that's a But come on, join us, Senator Powell. Senator Powell is one of the most accessible people in public service that I have ever encountered. And I'm fortunate to be able to call him any day of the week, at any time of the day, and say, I need you, and he show up. And years ago, probably 6 or so years ago, there was a lot of agencies that stopped funding sickle cell. And I called my friend Senator Powell and said, we need some help. And he worked with his peers in order to ensure that sickle cell was included in closing the gap of funding that was passed that year. So if any of you have received funding in closing the gap, that is because this young man right here is a champion for. So it's very important. The foundation does not endorse any political people, but I must say that it is important to know who represents you and what they advocate for. And they should advocate for the things that are important to you. And we're very fortunate to have someone here who advocates for us and is Senator Powell. Dr. Walker. Hey, Dr. Walker, how are you? My goodness, when we talk about someone that cares about the sickle cell community and who each and every one of our tests for sickle cell, Dr. Walker's office doesn't. She has been around serving our community for years, and we know that it is important that we have someone who's compassionate that works with our children and works with our families. So Dr. Walker, why don't you come on down and join us? I'm going to pass the microphone to Shanika so that I can eat. Thank you.
All right, let's give Shalonda another big round of applause. I tell Shalonda, the Sickle Cell Foundation has not been the same since she was at the Hill. Can anyone, if you agree with that, make some noise and clap your hands. As my grandma used to say, that's the God-given truth. Whatever that means, right? Again, I'm Shanika Moore. Thank you, Shalonda, for having me. Thank you, Keely. Do you guys like this space? Let's give it up to Keely for opening the door. We can provide the space to make us feel like we can talk. Let's have a conversation. So we want this to be interactive. If you have any questions for our great panelists, if you have, just raise your hand and I'll be scanning the room, but we're on a time schedule. She chose me because I'm military, and she has been at plenty of events. She know I'm playing about time. I will shut it down. We gotta go back to work. You guys got a lot of things going on. We got a lot of special guests, so thank you. Now this young lady right here, I'm gonna look over to her. I think we have it till 12:50. We started 5 minutes late. Did we get that 5 minutes if you want me? Okay, so 12:55. So we're gonna go ahead and start this dialogue by, we're gonna start with our guests, having them to share 30 seconds. You see their wonderful bios here. They're gonna share a couple of things about themselves briefly, and then we'll open up with the question and answer segment. Dr. Debbie?
So I am so honored to be here this afternoon. Working with Shalonda and the Sickle Cell Foundation, she knows I wear many hats in terms of uplifting and supporting the community. So you can find me at the Children's Services Council as a learning officer. You can find me in churches and nonprofits talking about mental health awareness and stopping the stigma through protective factors group. That is my private practice. But you can also find me at Palm Beach Atlantic University, training up the next generation of therapists. Because in our field, there are only 5% of African American therapists. And so there's a huge inequity in terms of opportunities for education, but most importantly to me, opportunities to serve our community and give options for culturally responsive. So anytime I'm invited to work with Sickle Cell Foundation, I come out and share all things mental health awareness and empowerment. Nice to be here this afternoon.
First thing I want to say is I love my job. I've been in the pharmaceutical industry for over 25 years. I've advocated in many different disease states on behalf of patients at the state legislature and lots of states up north. I'm fortunate enough now to be down in Florida. You see in the bio, my spouse has a rare disease. She has lupus. So main reason we moved down there is because of the weather. Up north is really difficult for her. The cold is a trigger for her. I can say she's doing much better, but I understand what the sickle cell community is going through, health perspective, from just how to feel in general. I'm here to help some of the folks from some of this about the audience that I'm engaged with, but I'm in the community. I think I have 3 more events this week. We're here to help support the community. And I just look so forward to hopefully meeting everybody. If you want to come up and chat afterwards, I'll stick around for long way. But I'm here, Pfizer's here. But I just want to say, I represent myself. I work for Pfizer, but I'm not Pfizer. I'm here to support the community. So I just want you all to know that. And, anything I can do for y'all. Thank you.
Thank you so much. We need people like you in our corporations that bring the information and the resources to the community. So thank you so much. Senator?
Thank you. Good morning, everybody. Good afternoon. I am Bobby Powell Jr., State Senator representing Senate District 24, which is this area. And I also am running for the County Commission District 7, which is also this area. I've served in the legislature for 12 years, which is actually the longest of any African American from Palm Beach County has ever served. And I've worked, and a lot of our work has dealt with sickle cell and really some of these diseases that are rare. I've worked with some of my colleagues to make sure that diseases that primarily affect African Americans are highlighted, because we live in a world where a majority of the world is not African American, the majority of doctors are not African American or Black, so they don't sometimes understand the need. And if you know about sickle cell, you do know that people who had sickle cell, they tell their symptoms, and sometimes they will not believe, are pushed on and just pushed away. So with that being said, I've been the chairman of the Florida Legislative Black Caucus. I did that for 2 years, from 2020 to 2022. And we work with the member organizations in terms of how we deal with sickle cell, and eventually we're going to see a cure. So I continue to work. I'm looking forward to working in that direction as a council commissioner, and continue to work with everyone here and in this community and with my friends who are in the legislature one day in sickle cell, make sure that all our people are healthy and like that. I remind you that a life of service is a life that counts. Oh, and I'm here with my staff. Mr. Malcolm Summers is my legislative aide. Malcolm, like me, is a native of Riviera Beach, Florida, and both of us went to FAMU all the different times.
Here we go with the clubs. Jonathan Walker, here we go with the family club.
And my two interns, Jonathan Jones and Trey. Both of them are both either in college or in college.
Thank you, Senator Powell.
Know that the one has been one but the good news is there is a cure. There is a cure right now. It's not widespread amongst people in this country, 30,000 people in this country who have sickle cell disease. Across the world, we know it's not just African people, they're Asians and some Europeans, and we say, I think our contraction very European, but has sickle cell disease, but primarily African descent. And so we are just happy to hear Dr. Collins know that I'm coming to them up, and I know a lot about them, great work they do. And so he's going to talk about the different types of things. So yes, there is a cure right now. And so I'm not going to talk more, but I'm just happy. And by the way, I used to be on the board of Sickle Cell about 35 years ago. So
Thank you, Dr. Walker. I'm gonna have a seat. Keep the mic, Dr. Walker. My next question is for you. I actually sit on the board with Dr. Walker for TV Work Jefferson, and we appreciate all that you do. Can you basically just give a brief synopsis of what sickle cell disease is?
So sickle cell disease is first and foremost a genetic disease that we characterize once we see that someone has it and they are sick from it. We know that the characterization is that the blood vessels are obstructed because the cells have changed from that normal donut looking size to a crescent or sickle size. And it can go through small capillaries and get ingested there. And so it is an obstructive, disease of the blood. The other thing that I want to say about sickle cell is that it is a genetic disease, so that if an individual has a sickle cell trait and they have a child or someone who has a sickle cell trait, there is a percentage, and we don't, say that all sickle cell is the same, but there is a possibility that there will be an SS disease. You know, there are different types, you guys know that there are different types of sickle cell. SC, it's not as deleterious as SS, but specifically it is a disease that is genetic. Secondarily, it's a disease that causes a lot of pain. It is a disease that now we know that through research can be changed and can be cured. And so the typical sickle cell person, if they're SS, is going to take them from birth to whatever age it is that they are now, we'll say that. So at about 6 months old, they lose what's called fetal hemoglobin. And those people who work in sickle cell, you know, this is protective. It helps us. And it helps the individual so that they don't have that type of crisis. But about 6 months old, they can use that. And the question is, with little babies, toddlers, little fifth graders have really bad disease? Yes, they can. Yes, they can. And so what are we saying about that? We're saying that there's been about 70 years that we have known about this gene. About 70 years. And what has been done? Well, not a lot. So we can't go backwards, but we'll go forward. And at this point, we know that there are different areas around the country. Duke is one of them. They're doing a lot of research, so that we know that we can transplant. But the problem with transplant is that you don't always have a good match, and we don't know like how many people are really doing well with that. And so the transplant may not be the real answer, but it is curative. If someone has a bone marrow transplant and they're successful with it, they're cured. That is curative. Yes, and then the other thing is that, you know, that there's gene mapping, and Doc talked about this. This is his bread and butter. As primary care, I can see a lot of sickle cell. Why? They don't grow to be 50, 60, 70, happy geriatrics. They don't get that, or they will, because now we have a cure. And so your question is, okay, so how available is this cure to everyone in the country? 100,000 people sickle cell, why aren't we all cured then? Well, one reason is facilities. Not every single hospital can accommodate what the treatment modality is for sickle cell. That's one. Secondarily, there's a financial thing, but I agree with the school of thought that if it takes $2 million to do a treatment, $2 million is worth it. Why? Over the life of someone who has sickle cell disease, the cost is about $7,000, but $47,000. And so if you can do a one and done, which is what some of the gene strategy is, then it's worth it. The other thing is there is mapping that's done. It's also expensive. It's all expensive, but when you look at it overall, it is more expensive to have someone. Some people have only a crisis in you know, maybe once every 6 months, but some people have it every month, and it's devastating. It's extremely painful. So and I know I skipped a lot.
They're walking.
Yes.
I'm over here. She's very passionate about and you just put out a whole bunch of information in that one little statement. I want to ask a quick question. So it's pretty much genetic, just for people that don't really have an idea.
It's in the genes.
It's in the genes, and it's something that you can find out about later in life, or is it triggers? Are there triggers? And I just kind of want to set as a premises.
Every child is tested at birth.
Okay.
Every child is tested at birth. So we know at birth who has sickle cell. We know that. And so you might say, well, if it's, hereditary, then why don't we tell the people who have sickle cell trait, before you have a child with such and such, get them tested? Hence the Sickle Cell Foundation. They test everybody that they can. So that would be nice, but we know how the real world is. We know that we have a trait, but we feel pretty good. This is just a trait. But am I gonna like scrutinize? Oh, well, have you been tested? No, we gotta get a hemoglobin electrophoresis so we can see what kind of cells you have. I don't think the young people are going to do that too quickly, okay? It's a good idea and it's a good strategy. So we can say that, we can try, and everyone who has sickle cell trait, we tell them that. Listen, if you know, it's a possibility if you have a child with someone with a sickle cell trait, then you have sickle cell disease and it's devastating. And they say, yeah, I think it's important. Yeah, but do they go by that each and every time? I don't think so, okay? But since we have a cure, at least for that one person, it makes a difference. So, so that's what it is. It's genetic. It's in our genes. About 1 out of 350 babies have sickle cell.
Okay.
About 1 out of 350 babies. Yeah. So that's not a few people. And then when you look worldwide, we're talking millions.
Thank you. Thank you, Dr. Walker. We appreciate that information. Anyone on the panel can ask this question: what cognitive and behavioral pain management strategies can be effective for adults and children with chronic pain related to sickle cell?
You know, I love that question.
You love that question?
Yes, because this is something we have to talk about. And I love that Dr. Walker started with the money, all of the money, because by 2040, it is going to cost America $240 trillion in mental health care if people do not get the care that they need. And so for those of you who are here, who have family members who have sickle cell disease, or even yourself, and we know that pain can cause a lot of mental health symptoms, whether depression, anxiety, and even thoughts of suicide. And so I'm here today to encourage you to get that mental health checkup. Check in on your health and well-being, social, emotionally, checking on your thoughts, but also what has happened in your life. And some of the treatments that you can ask for are cognitive behavioral therapy, which help in terms of determining what are your thoughts and behaviors, building your confidence, finding solutions to problems, asking for other psychoeducation that can give you information regarding pain management, what are the healthy ways, and then learning some relaxation techniques such as mindfulness or meditation, deep breathing, all of those strategies that relax the mind, relax the body, and get you operating in your optimal way of being.
Thank you. Paul, how can, we heard the passion in your voice about connected to community, and we're raising more awareness about sickle cell. And why do you feel the need that they do so? I mean, it's, I always tell people, you gotta have boots on the ground. It makes a big difference. And so what do you, how can community and other corporations and organizations raise awareness?
Well, first of all, I want to say all the groups that I work with in the state of Florida, there's upwards of 30. Every single one is doing an amazing job in and of themselves and by themselves. One thing I would suggest, and I think we're actively working on it, is to encourage all these groups to work together. We're all after the same things, but what I've discovered is that some of the groups kind of specialize in one area versus another. So I see my role as trying to connect the groups and share what I see other groups are doing. That way we can, if there's an event, we can maybe work together. I can give you an example. On Saturday, there were 3 events. Some were competing, some were in the same area, some were in different areas. I want to be at all of them because I think the way I can make change and show commitment is to be there. I can't be in 3 places at the same time. So that being said, I think we need to work together as CBOs and share resources. The other thing is I think CBOs working directly with pharma like we're doing today. I have to earn your trust. We all have to earn the community's trust, and by being here, I think we're starting that process. I think working with municipalities, gaining insights from municipalities and partnership opportunities with municipalities goes a long way, and we can reach more people. Two other things is what we're doing at Pfizer is we have a series of community action programs. We can go out into the community and do these live or virtually. One of the programs is called Tools for Self-Advocacy. We want to provide education, information to allow people living with sickle cell disease, caregivers to be empowered. Once they're empowered, they can advocate for themselves in different settings. And the different settings could be just a regular doctor's visit. Make sure you're ready, you're prepared, you have all the information, the questions you need to ask your provider. When you end up in an ER and during the event of a crisis, like how do you handle that? Are you prepared? Because when you're in that much pain, you may not be able to communicate properly. So there's ways to focus on that. Ways to advocate for yourself in the school setting. So if you're a caregiver, how do I advocate for my child? Or if you're someone you're going back to school later in life, how do you advocate for yourself? And then I think lastly, there's just lots of ways that we can all work together. We are creating programming, and I think what I'd like to close on is I want to put it out there. We don't want to forget about the caregivers. The caregivers are in this, and sometimes they're forgotten. But we're trying to work on some programming for the caregivers around mental health, because that's extremely important. If the caregivers aren't in a good place, then we can have some, potential issues with that person that they're caring for. So we know that they're extremely important. We don't want them to forget.
Thank you so much. Two things you hit on, caregivers and working collaboratively. It's so important. We're better together. Your presence is making a huge difference being here at this community forum. And I know from just working for hospitals for years, caregiver burnout is real. With the hospice industry, over 35% of caregivers burn out before the actual person they were caring for. So the fact that you mentioned that lets me know you guys have done a deep dive into this. So thank you so much for that. Senator Powell, how can we advocate for legislative efforts that are crucial for improving access to care and research for sickle cell? We appreciate all that you're doing back and forth to the Capitol, and so what can we do in this space concerning sickle cell as an advocate?
I'll tell you right now, the legislature, the members of the Florida Legislative Black Caucus are very engaged. We have our annual conference in Orlando around classic time. And we had another conference that we started having in in August. I don't know if we'll have that again this year, but it's called the Orange Blossom conference, where we also deal with this issue. And sickle cell has always been at the top of our list. When we talk about the Florida Legislative Black Caucus, talking about 27, give or take, between 27 and 30 Black state legislators and Black state senators who represent all areas of the state. Me representing Palm Beach County in the Senate, Shepard Jones representing Miami-Dade, parts of Broward, Roslyn Osgood in Broward, Darrell Ruston in the Tampa area, Tracy Davis, Geraldine Thompson in Orlando, Tracy Davis in Jacksonville, and then the state representatives run the gamut, right? And it's always our cause to talk about the most up-to-date technology, including gene therapy, some of the other things that are coming up, what's happening in the world of sickle cell, and dealing with people who are working on sickle cell issues every day. We've got a working relationship with Dr. Bronte Hall, who has the clinics throughout the area, and making sure that people are aware. The biggest thing that we can do is from our own community. We represent all areas of the state. So when I come back to town, I usually have town halls, and my colleagues also have town halls. Sometimes I'll team up with another legislator, we'll do town hall in Riviera Beach, where I'm from, West Palm Beach, haven't really done any in labor park, that's not like labor park, they were, but we can. We have that ability to also bring in healthcare providers, bring in the Sickle Cell Foundation, Shalonda, and really discuss this holistically, so that people have an awareness and an understanding. One of the biggest issues we saw when it comes to legislation, and I'll be truthful, Dr. Kerry Pickman, who was a former state representative, who was also the chairman of the Health and Human Services Committee in the Florida House. When we were talking about closing the gap grant, and I went to him and I said, hey, please put my bill up on the agenda. So the way it works in Tallahassee is there's committees, there's committee chairs. All of the chairs of the committees are the majority party that's in power, the Republican Party now. It has been since I've been in Tallahassee. So I asked him to put my bill up, and he had a problem. He indicated that WSCD disease mainly impacts Black people. So I had a conversation with Dr. Corsi at the time and Ms. Warren, and we brought him more statistics that it not only affects Black people, it also affects white people and Hispanic people. But notice the tone. This is a person who is a committee chair in the legislature who did not want to pass a bill closing the gap funding because he thought it affected one particular group of people. Now, this is happening in Tallahassee. These are the things that people don't hear about and want to talk about. These are the things that I'm constantly fighting for and fighting against. And luckily, I wasn't in the Senate at the time, but our senators are much stronger sometimes than the state reps. And I was able to go and talk to Senator Arcadia Joyner, who is a civil rights advocate and lawyer and fighter, who also went to family. And she went over there and with me and made sure that that bill got on the agenda. Someone said, if you don't put that bill up, all your bills is gonna die in the Senate. I would warn you to be careful. You must not know why.
Well, it's important to know certain people in certain places that are a voice, so thank you so much, Senator Powell. Dr. Walker, what lifestyle changes can a family or patient make to maintain overall well-being while battling this disease?
I don't want to belittle the type of disease it is. It's excruciating pain when there's a crisis. And as far as maintaining lifestyle, we say the same thing for all diseases, hypertension, diabetes, a good diet, plant-based diet, staying away from junk food, staying away from fast foods. Fast foods will kill us. The factory foods will kill us. And so we say the same things. Things that come from the ground, the bush, the vine, and those things that come from the trees, those are the things that we should eat. That's the diet. Drink a lot of water, especially when people are having crisis. Water, because when they go to the emergency room, what do? They get hydrated, right? So just trying to drink a lot of water for all of us, and especially those individuals who have sickle cell and maybe going through. Some people have they know they're going through crisis because they begin to feel it, and then it may subside with water. The other lifestyle changes for all of us is the same thing. To increase our heart rate, to increase our muscle mass by doing exercises and doing those things that we like. Because if you say I'm going to go to the gym and you don't really like doing that, you say it because it sounds good, we're not doing it. We do what we like. So whatever it is that we like, and it's our heart rate up, we do it right here in your house. You can do
The excuses are gone. There's too many ways to get it in these days.
Of course, we also, I've had analysis of this, for families who have sickle cell, people in emergency room, or friends, we advocate in the emergency department. Because there are, like I said, primary doctors, geriatrics, and we don't see sickle cell, but they are always dead. They have private trade, lose their spleen, they would have all kinds of devastating things with their eyes and blindness. And so all these organs are destroyed. If we don't see them, we will because we have a cure. But we don't see them in our next population. Except for those people that receive that, right? All right, but anyway, oh, there you are. So we have, patients that, he's not SS, and friend of mine, because he's a advocate for sickle cell. So, but he's an SC, but still has crisis. So, just be an advocate for your family, when they go to the emergency department, a lot of emergency room doctors do not get an adequate amount of pain medication. And some doctors who really understand this disease will give their patients FSS a supply of medication that will be effective for them when they start the crisis. And so you're right, there is disparity here. There's disparity in everything when it comes to certain people. So, and by disparity, I mean they don't want people that look like me.
Absolutely. We're gonna, thank you, Dr. Margaret. Do we have time for one moment for questions? That time went by fast, right? Are you enjoying the discussion?
It is by. We're all, just indulge me. I know that there are quite a few people here in this room that have, the caregivers of someone with sickle cell, that, may have sickle cell themselves, have experienced some of the things that we've been talking about. And, it's one thing to talk about a comprehensive approach and talk about it from a caregiving perspective, but I definitely, and I think the people who listen to you would love to, and y'all can watch on the microphone. But guys, if you have 30 seconds of something that you would like to share or a question that you would like to ask, I assure you that someone else in the room has that same question or comment. So be encouraged to participate.
Hello, my name is Alan Campbell. I'm from the Sickle Cell Disease Foundation from Miami County. And our foundation, our mission statement is to bring awareness and prevention to sickle cell anemia. And being that our young people, they have sickle cell traits, they have sickle cell anemia, and they are in schools, right? And so at some point, one sickle cell male might have some feelings for a sickle cell female in school. And so what are we doing about that? What are we doing about educating sickle cell anemia in schools where, our little children are real active in school now, who don't know their status? And so that's the vision of our organization. We want to get into the schools so that the students can know their status, so that we can prevent the kid.
Shanika, would you share your microphone? Is there anyone that would like to address that or show?
Great question. So what I can tell you is there's one group that I'm aware of that has spent a lot of time doing just that, working in the schools. And what I can do is I can get that information to you because they already kind of develop that playbook. But we do know that that's an important place to educate all the administrators, the staff, the teachers, obviously, not just, if you have a sickle cell child that they need special accommodations. And these are some of the things that we talk about in this program and we can offer. But what I can do is make a connection for you with that community-based group that already has the program together, and you might get a benefit from that, and create something which is to your needs, but most sensitive to create. So I'll get back to you.
Thank you. And we're going to do a rapid fire. 30 seconds to a minute, because I know that there are a couple of people that have some questions and we're going to move forward to our meeting. So I'd love to hear from you, Dr. Gibb.
Well, Children's Services Council, because we fund the Sickle Cell Foundation, and there's also children's services in Miami-Dade. And so the Sickle Cell Foundation here works with the schools, but also works with the Birth to Change Initiative, where we do a empowerment conference each year, where we share with the information around what is sickle cell, how to be aware, what is the need if I have the teams for the trade. And so I would say look into Children's Services Council within Miami-Dade. For those of you who are from Broward, it's the same there, to see what funding or grant opportunities they may have for you to increase the services and community awareness.
love Dr. Debbie, because that is true, and the Sickle Cell Foundation of Palm Beach County Treasure Coast does go into schools. We are out and we're participating in when we provide education services to our school district. It is very important that we are aware. And I think you might have said that people don't know that they have sickle cell trait, and that's the parents, because we do receive that information, because they are all sensitive, and we have to make sure that we share that information with the children. So, see, I know it's gonna spark something.
And I just
30-second rapid fire, because we got a lot we wanna cover.
Good afternoon, everyone. My name is Rebecca. I'm from St. Lucie County in the Treasure Coast, off the Treasure Coast. And I'm a mother to an 11-year-old with sickle cell. He's currently in the process of going to have surgery on both sides of his hips for AVN. So I came here down here to find out, where do I sign up for this? I'm ready to get things going. I spoke to his hematologist about finding like, I know it's approved, FDA approved, but no one has really told me of sites or area or places in the area where they initiated and it's out in the public to get things going. That's why I came down here to find out, where do you start to get things going? Is it insurance? Because, you know, I understand they're educating and bringing out that it's been FDA approved, but where is it initiated and where has it started? Because that's what I'm here for my son to find out.
So there's some clinical trials, and I will just give this to anyone who wants it. I do have a link for some of the clinical trials that are going on in the country. And as was said earlier, every hospital doesn't do it, and every hematologist is actually not aware of what, when, and how, because your son has a hematologist, right? So there are places in the country that are set up to do this. And as far as what I know he's going to talk about everything that we have available in the United States. But yes, there are many places, and a lot of places now are asking for individuals to join for clinical trials. So you know that there are medications that are oral, but we're talking about curative. The medications that are oral are good, they help us, but you're talking to a cure. And yes, there is an opportunity for the 100,000 people. And I know that's a big volume, but it needs to be exposed to information that is more than just simply normal.
Thank you, Dr. Walker, and I heard what you said, and I understand that you're saying you would love to be a part of any opportunity that exists for your son to be able to be cured, because when we talk about a universal cure, then people believe that there's this blanket cure that has come and everybody can participate and sickle cell has gone away. When the reality is that it is not as easily as accessible as what we're led to believe. And it's extremely expensive. So, and that's why it is important for us to have these kinds of conversations so that we know that there are people that want to participate, but that the access does not exist, and we would like to believe it, and that we have to continue to advocate and continue to fight and continue to have people like Senator Powell that help us to get the funding, because it is impossible for us to do it on our own. It will be very challenging for you to do it by yourself. It's very challenging for a foundation like Sickle Cell to do it. So it is important that we are working together and that we are identifying how we come up with the advocacy, what that advocacy looks like, so that they can come here where we need it the most. Yes, ma'am, I heard you.
Good afternoon, everyone. My name is Trudy. I am 75. I have full-blown sickle cell. I lost my skin. I don't have a skin. I had 2 strokes. Would there be any cure for me at this age?
So we have SS. That's amazing. And so I'm gonna say this, that Vertex, which Doc knows about, this company has 100 people that they have to, and I say 100 people, that's not much, but that's just the beginning. And I don't know how far this has gone, because I don't know what the research is right now, but that's the possibility, and that's a question you're gonna ask. at the forefront of this.
On that same token, I've talked to, Tyler Craddock, who, I think, for another company that's worked with the Black office. And my understanding, I just want to make sure we understand the difficulty in is in line to be able to receive this treatment. I know something you talk about clinical trials, we're in clinical trials and where we're at right now in gene therapy in terms of who's being cured, you know, what's the cost and when this will be, as they continue to do this, when it will be more widespread, when it will be accessible to, you know, the average person who's dealing with taking their child to the emergency room, crying and they're staying up all night and they can't deal with the pain. And they're crying because their kid is crying, and parents and who are dealing with sickle cell themselves, when this is gonna be available.
Thank you, Senator.
But we can provide without and as long as how much does that cost? And so the suggestion is that costs about $7 million. So would you rather do the 2 million, one and done, or the 7 million?
That's a significant number. We're gonna be able to talk to everyone at the end of the program. So we're gonna do a couple of rapid fire questions and comments. Dr. Shaw, you all right with that? Thank you, sir. And I want to say that in the 10 years that I've been at the foundation, now more than ever before, I'm starting to see more and more sickle cell research. When I first started, there was a tremendous amount of despair, and now there's a tremendous amount of hope. So I know that although we may not have deep universal cure right now, I'm believing with my whole heart that the approaches that we will see will not simply be, and from your perspective, where you are excluded from the opportunity to be rid of the suffering that you have endured your lifetime. It hasn't happened that I am aware of yet, we're believing, but we'll let the expert address some of this.
You look amazing, by the way.
Hello, everyone.
I know, this young lady, you look amazing. Yeah. You look good too, Shay. I'm talking about it, for the young ladies. And we're gonna, is that our last one, just for the time for sake, I gotta keep my friends.
This lovely young lady right here, is Miss Vivian Washington White. Vivian Washington White, when I started with the foundation, she was a volunteer. And she was bossing me around and telling me what to do. I said, ma'am, I think you need to be on my board. So she was a board member for the Sickle Cell Foundation. She just celebrated her 10-year anniversary as a board member. Miss Vivian is also an amazing sickle cell warrior who has lived her life beating down sickle cell and educating other people, and has a background in medical care, and has actually retired nurse from the school system in St. Louis. So how old are you, Ms. Vivian?
Just wanted to answer her son, you need to go online to the CDC, HR, get those different federal organizations for more information inside yourself for research. But that's what it is, it's still research.
And we're gonna stay around after the panel and after Dr. Shaw, so we can continue to encourage each other, because it's important for you all to know that you are not alone. And that there are people that deal with the exact same thing. There may be answers that are sitting in this room.
Good afternoon. I was just gonna say, I also have betrayed, my son is 25, he has full-blown SS, and, he has a long history of suffering and dealing with sickle cell. The thing we need to get to our youth and let them aware of, my generation, when we weren't tested or tested later in life, once we had the trait, I remember from age 5 on saying, I have this trait, I don't want to pass this on, be careful of who you mix with, as my mom would say. And unfortunately, his father was unaware, as many adults my age were unaware that they did have the trait. And we need to let those youth and our youth know it is a 25% chance that you will pass this horrible disease on. And I think if you can, and let them know about this,
and the importance of, yeah, you get along with someone and you're attracted to them and as such, but this is a horrible disease. It is 25% chance with 2 sickle cell traits. And I think when they see this themselves and hear about this more and more and know the suffering, because everyone knows someone that's had it, or a family member, they know this, we need to stress this 25% chance. And I was praying it wasn't gonna be me, but it's 25% chance, every single pregnancy.
Thank you very much, and I'm going to wrap up our panel in just a moment, but I do want to say that we're very fortunate that the Sickle Cell Foundation has received funding from Community Foundation of Palm Beach County and Martin County, and from our friends at Quantum Foundation for a wonderful program that we are launching, and it is called Sickle Life. And we are focusing on our youth that are transitioning and hoping to empower them, and you all, those that are in the area, that are in the Palm Beach County, Palm Beach County and Martin County area. Dr. Debbie will be working with us as well, because we know that it is a tremendous amount of information. There's a lot that you deal with physically and psychologically. And one of the things that I know that happens is parents have a lot of psychological weight that they carry. But I want you to know that this is not something that you should feel burdened by. It is something that we're going to work together to be educated about so that we can cause the change that we're seeking. So can I get a round of applause for our panel? Thank you all so very much. Thank you very much. And
Can I just say this, you guys do such a good job of educating the community here in Palm Beach County about this disease. And you touch every age group. And that young man was saying that from Miami, you're at all types of functions. You're not just at adult, you're a kid. Everywhere you look around, you see sickle cell. And so kudos to you and your team and your staff for making sure that the awareness has been brought about in the community about this disease. If you don't know, you just don't know. I wanted to say that. Thank you.
my friend. Now, I'm going to bring forward a gentleman that, and let me tell you, I really wanted our keynote to come and join us today. When I told you about our new programs that we have, Sickle Through Life and identifying the importance of transitioning, because we have so many kids that once they become 18, they lose their insurance, they get dropped off everything, stuff happens, and we expect that they all of a sudden are supposed to know everything. But have we been able to equip them with all of the tools that they need in order to be successful? What I have learned in the 10 years that I've been in this agency is that we need a comprehensive approach to sickle cell. It is not one person or one thing or one entity. It starts with the child. The child that is born with sickle cell disease. We were fortunate to find Dr. Shaw. Dr. Nirmish Shah is joining us from Duke University. He has come and traveled, and let me tell you, when I say that this event was sponsored today, when I tell you that I offered Dr. Shaw, and I'm sorry, that I offered him this site for coming today. Do you know that he refused to accept that from us, and he wanted to come and meet with you all today and share with his heart and the research that he's done and the things that he's seen, the information that he feels will be beneficial to you. When I tell you that this gentleman is accomplished, he is a professor, he is a medical professional, he has led research, he has more than 100 publications, more than 100. And I asked him to come and share this day with us, the World Sickle Cell Day, and he had a lot of invitations. And there were a lot of people that wanted to spend time with him, there were a lot of people that wanted to hear from him, and he chose and spend this afternoon with each of you.
Thank you so much. First of all, I appreciate the opportunity to talk. As was introduced, I take care of both kids and adults in a unique situation. Medicine and pediatric training. I take care of babies, I take care of young adults, to take care of patients who are on the older end of the spectrum, who are really showing us that we are getting to a point where we have more immune success. When I say success, success is what my patients do what they want to do. And so I focus most of my visits on what do you want to do? Where do you want to go? So there are three things I want to offer today. And as I said, it's an adult, so I take care of pediatric patients, adult patients. I run the transition program. I'm very lucky. I can walk my pediatric patient to my adult clinic and say, this is a unique clinic. There are differences with adult clinics, a little bit more stark. We don't have the colorful walls and the paintings, and we don't have music there. But we're trying. But the three things I want to pass on today is I'm going to have a conversation. This is not a PowerPoint lecture. I'm here to talk. I already have so many things I want to say based on what was already said that it's going to take a long time. So I'm going to just jump in. Three things I want to do here. I want us all to focus on learning about science. I want us to focus on educating about science. And number three, I want to focus on empowering us about science. So if we learn, I learn every single time I give a lecture, every single time I meet a patient with sickle cell. I want all of us to focus on the fact that we should learn as much as we can. Because the next step is to educate others. Educate those around us, educate patients and families, educate medical providers. You will, without a doubt, go to an emergency room or a medical facility and find someone who does not know as much as you know about sickle cell. It's unfortunate. It does happen. And then the third thing is to empower, give that knowledge to that person, then have them feel it forward. You're empowering not the patient to advocate for themselves, but empower that medical provider to know what you know. So those are the three things I'm going to hope to go today, and it's in the context of transition. And the reason that's important is when we learn and educate others, we do have to make sure we talk in a language that is understandable. I think if any of us know or have teenagers, know a teenager, we know we can't just talk like a normal human being. We got to talk a different language. If teenagers talk differently, we have to talk differently. So when we educate the same way, we have to make sure, because when I'm in the room with the patient and family, many times you go, yeah, Dr. Shaw, I understand what you're saying. They're not. They don't want to tell you, Dr. Shaw, that I don't understand what you're saying. So I have to make sure they explain. So that's what I'm going to do today. I'm going to go through three things in how I teach. So yes, we're going to learn, educate, and empower. But when I go through transition, I go through this idea of the who, what, where. Who we are with the disease. Why do I need to know about symptoms? Where am I going in life, and where is it that I need to make sure I think about the problems I'm going to be doing with? Okay, so let's start with the first question that often comes about transition, which is, when do we start talking about transition? Now, there are some mindsets that you should start as soon as birth. There's a lot of other things to think about in the toddler years, in the upcoming teenage years. But by 12 to 13, we should be talking about transition. Transition is a process. They should not be talking to you about moving to the adult world when you're 18 and it's your last visit. That is way too late. Because we need to get all our patients' families ready for transitioning and transferring. So we have to be very careful about that. Transferring is handing the baton off, handing all this information to the adult world. But you have to, you have to run that whole marathon, that race to get to the point where you can hand that baton off. So the who is knowing the basics. At age 12 to 13, I want to know who that, I want that patient to have some ownership of what sickle cell is. At age 12, I always ask my patients, Jimmy, do you know why you're here to see me? He's like, I don't know, I'm around here. Not getting to school. And let's think about this. Let's think about it. You're here because you have sickle cell. You know what kind of sickle cell? It's important to know you have what type of sickle cell. SS, SC, S beta thal. There's actually several different other more rare types. Just have them understand what type of sickle cell. That's the first way I identify that they know that sickle cell and I'm taking SS. They should be able to recite very easy. Next, they should know how they got sick. That trait, not from mom, that's not something you get as a cold, you don't get it from somebody else, it's not contagious, they need to understand they got it from mom. Next, you need them to understand what are the issues that can cause more problems. So cold temperatures, very hot temperatures, changes in barometer, which means when it's about to rain, you can feel it. So those are things that you need to understand. Dehydration, drinking lots of fluid. As you drink like a fish, you can be like a whole thing, going and going and going. If you need to make sure that your teachers know that, because they need to give you the opportunity to go to that. I'm telling you. Other things that they need to know is infections and breathing issues can cause problems. You have a cough and a cold, maybe okay, but you need to let mom know that it's not having problem breathing or having an issue with her. Potentially oxygen getting. So those are the basics with the food. And then the last thing is I start to get them to understand what sickle cell looks like and what it is. So I draw on the exam room table all the time. We should be making things very visual. Kids are very visual learners. But next to the point, I also say I don't give lectures to my kids. All my patients, I don't give lectures. Now, what do? They watch 30 to 60 seconds of property games now, right? You have 30 to 60 seconds to get that attention and information across. And take a break. I'm happy. So I'm going to draw these pictures out. And again, speak in a way that they understand. When I talk about different types of blood cells, very easy. Red, white, and blue. We got red, white, and blue right here in the blue here. So red blood cells, those are ones that can sickle, they carry oxygen, they give energy to the body. The white blood cells, they fight infection. And blue is what are called platelets. They actually help you stop bleeding. Red, white, and blue. And then I come into the room and I say, look, this is what your slide looks like. This is what your blood looks like. I'm going to make this. I want to bring that in and have the patient see what their blood looks like. So there's a red blood cell, there's a white blood cell, there's a platelet, the blue. And you're getting the patients to really start feeling invested in what's happening. And then the parents are like, oh yeah, this is kind of cool. This is interesting. Then they start to get it. So you want to talk in a way, and then it was brought up before as well about the red blood cell being kind of like doom. You brought that up. And so I give the next level. It's like a jelly donut. It's nice and squishy. If you took a bite out of that squishy donut, what happens? With a sticky jelly on the side. Right? All that sticky jelly, then things get stuck. And the patient gets to understand what's happening on inside of it. And if blood doesn't go to where it needs to go, it's a problem. If blood doesn't go to the bones, it hurts. Blood doesn't go to the lungs, it's a acute chest. The number one cause of things going bad, blood doesn't go to the brain, it's a stroke. Those are all tied back to the sickle cells in my being. So that's the food. And I want to get that into my patient's mind. I'm having to remind them over and over. But 12 to 14, that's what I'm doing. 15 to 16, we get into the what. What do I do? What are the complications? What is my pain action? What are my medications that I'm on? And we'll get into this. There's a lot of conversations happening about gene therapy, transplant, medication. But we need our patients to know what they're on, when they take it, even if they're on pain meds. They should know, even if they're not dispensing it to themselves, they should know what pain meds they're on. And it's all about self-advocacy. So this what is now 15 to 16 because they're starting high school. They need to know. They're going to high school, they're really trying to do things on their own. So that's the what, and what are the complications? Now I'll tell you the story because it really resonates with why I do this. I tell my patients, if you're at risk, and you don't imagine this is going to happen, but it's a rare side effect, you're at risk for a stroke, and blood into your brain is stroke. If you have issues with talking, you have issues with visual issues, you have problems with weakness on one side of your arm or leg, you have a really bad headache that doesn't go away, you need a lot of remember. And you should, when I go to the next extreme, you should expect to go to the hospital and do what's called an exchange transfusion, which means you have a machine next to you that's going to filter out the sickle cells. Because I'm worried about stroke, I gotta get that sickle cell out of you. So I go through all these steps. The story is that I do this all the time. I had a doctor 2 hours away home. And I remember very vividly, I was walking onto the soccer field for my daughter. And I got this call from this doctor, probably 9 days. What's going on? It's Dr. Shaw. Your patient's here. She had a really bad headache. We're worried she's having a stroke, and she keeps talking about this machine that should be next to her. I was just impressed that my patient was telling this doctor who didn't know sickle cell. She remembered what I said. She didn't know what the machine did. She just knew that she had mentioned next to her. That's fine. And so, yeah, short story here is she had a stroke and it worked out. We got her to do everything worked out. She didn't have a stroke, but she knew what needed to be done. That's why we do this. That's why we have these conversations to make sure the patient and the family, and the mama didn't know what was going on. Mama's like, she keeps talking about this machine, not what we're calling it. So you need to make sure you have these conversations, like what are the complications? If it's a stroke, chest syndrome, if it's fatigue crisis, talk about these complications so they know what are the things that they need to consider. And then the where, 17 to 18, where are you going in life? And I start this a little bit, but you want to talk about what do you want to do? I had a clinic just earlier this last week on Wednesday, and my pediatric clinic, I said, what do you want to do? You start shot, I haven't really thought about it. You're 14, 15, you need to start thinking, where do you want to go when you finish high school? What do you want to do? Well, you know what? I do kind of like drawing. That's amazing. Bring in your artwork. Show me what you got. And let's talk about what all you can do some digital design. So, yeah, I do like computers. Start stimulating that concept. So where are they going? And support you to get there. And I go to the point and say, well, I know you can talk about community college. Open the application. What is the community college you're talking about? You just set deadline for that community college. Push them a little bit. They're not going to listen to moms. Okay, but the doctor or the family, they're going to listen to you. So you want to push them to where they're going. Yeah, they could, if they can't assure you that they're going to go to school, where do you want to work? Are you going to volunteer? You're going to volunteer at church? What can make it for that and happen in what you want to do? Again, going back to I've had 16-year-olds just recently graduating from high school, go on to college at 16, became a social worker, and now is a social worker for 6%. Amazing. So many success stories. But you got to promote that concept of hitting them to remember who or what and where they're going to be. Now, one thing I talk a lot. Yeah, you'll notice by being this. I love to talk. In the recent one thing that I want to offer here, I mentor a lot of residents, students, anyone who's interested in sickle cell. I'm bringing in. Let's talk. When they go in to see a patient with sickle cell, I challenge. Go into it. I know we've talked a lot about pain. Pain has come quite a bit because without a doubt, it's a major issue. Number one reason for hospitalization, number one reason for things that we need to address. But sickle cell is not just pain. Sickle cell has a lot of other things that need to be addressed. So I challenge my learners. When you enter the room, don't talk about pain. Talk about everything but pain for as long as you can. 20 minutes, 30 minutes, well, as long as you can. Talk about everything else. Talk about boyfriends, girlfriends, talk about school, talk about what you do over the summer. Because you want them to identify you as a healthcare provider. They're coming to the doctor not for me, and because they have. So we need to get them to understand everything else is important just as much as understanding that it's pain action. There's a course of pain action. Everyone, pain should be different. It's individual. So that's my transition discussion. I boil it down because I can hold back. There's a lot of questions that can come up during this first questions that I conversation. I want to give time for questions as well. That there's military presence in the room here. So we're going to stick to the time limit a little bit. But what I want to offer a couple things here. So first is we have come a long way. Definitely come a long way. Within the last 5 to 10 years, so much more research happened. So much more research happened. And yes, clinical trials need to continue. But there's actually, we got to the point where we've gone from 1 medication that was approved to 4 approved medications, and now 2 gene therapies. Now, I'm going to get into the gene therapy in just one minute. But let's just start with 4 therapies. I'm very general because I'm not coming to specific here. Hydroxyurea medication we started 9 months of age very early. Then we have, Oxbryta, it's approved as an oral medication that helps you bring up your hemoglobin to 4 and older. L-glutamine is an antioxidant, kind of like, L-glutamine is you get at the GNC store, but there's a pharmaceutical version of that, and it's an antioxidant called five and older. And then we have one other IV and IV medication supposed to prevent anemia, for 16 of that. It's 4 medications. I will say right here and now, it's not enough. We need more. And there's more coming. But it's a good start. Now, the problem that often happens is that they'll start, for example, hydroxyurea, they'll start Sprite, and they're like, it's not working, Dr. Shah, it's not working. It may be working, but with sickle cell, it's a chronic disease. It continues to work on the body. So almost no matter what you do, you still got sickle. And sickle cell is gonna, your body is finally gets to the point, the body's like, I'm tired. Body's like, I'm trying to make all this blood, just can't keep up. And as you get older, amazing that people to see you as you are right now. So you live that many years and have your body just get through this. An amazing thing to see. And we're seeing more of that. Because in you, yeah, amazing. I'm just smiling. That's so it's a huge smile to see you. Because we're seeing more of the situation where patients are surviving longer because we do medications that are protecting for a period of time. Now, what we need to do is act as early as we can. So I will offer as soon as we can get you into care. I would encourage you to share my email anytime. I always share my email with everybody. If you Google my name, it comes up. So it's no secret. You can always look me up in email. Because I want to offer you need a local person. You need some advice. We need the best advice I can outside of a medical visit. But I will get you to the right. One thing that we just had recent push for is in our group, my brag about this, she is someone that is a mentee of mine, but she is focusing on geriatric sickle cell. That's her specialty. The fact that you can say geriatric and sickle cell in the same sentence is just, we weren't able to do that. So we are making progress. Definitely making progress. So let's just talk, I'm going to talk about, because it can't come up a couple of times, about curative therapies and gene therapy. I know this is going to come up, but I want to be a little bit cautious about gene therapy. I'm very optimistic about what's coming. First, gene therapy is a near cure. It's not a cure. It's a near cure. Hemoglobin gets close to normal, not normal. It increases your fetal hemoglobin, the baby blood that's protected to about 40%, which is you can be very protective, but it's not for everyone because I have to give you chemotherapy to then make room for this new bone. Now, the difference, then, just as a very general description, standard transplant, standard transplant is going to get someone else's bone marrow. It has to be a perfect match. That doesn't happen very often. It's very hard to have a matched sibling donor. If you have a sibling for a patient with sickle cell, detect without a doctor detect 5% or so will be matched. 9%. In the end, 5%. Then, if you do have a match, you will clean out the bone marrow with chemo, and then you give that person's bone marrow. That's a bone marrow. A couple things can happen. One is you can reject the bone marrow. Number two, you may take the bone marrow, but the bone marrow you get, and you fight. That's how grafters support it. All these immunosuppressive medication to suppress your immune system. And then finally, it may not be a good fix, but if all that works out, it's a cure. Without a doubt, amazing if it works. Now I have gene therapy. Same thing, but the nice thing with gene therapy, optimistic, and we'll talk about pros and cons here, is that I take your own bone marrow out, patient's own bone marrow out. I change a gene. It's very cool. It's like a science lab. We go into the lab, we change a gene to turn on the baby blood. Get the baby blood of 40% to slow protect. And then I give that bone marrow back to you, which is your own bone. So you're not going to reject it. You're not going to have graft versus but you still got to get chemo. You still got to get chemo. That's That's my hesitation. Because it's already shown that in sickle cell, patients who get chemo with sickle cell have a higher risk of having secondary malignancy, secondary cancer, leukemia, 10 years later. That's already been established. So now, and it makes sense to a certain degree if you think about it. The bone marrow is so active, it's so revved up, it's just time. And so it's all so crazy active, and then you add some chemo. That's not a good mix, not a good mix. And that actually gets worse as you get older. So going to what you were saying, at 75 years of age, as wonderful as you look, we're not considered that life. Now, I am always very optimistic where we're going to see the path, and I will say, cystic fibrosis has 10 times less patients. Maybe only 10,000 patients in the United States. That's 3 to 4 times more funding in symptoms. That's changing. Only in the last 5 years. It's changing. So we're finally getting to the point that there's recognition. The reason that's important is that now even newer versions of gene therapy are being tried. Not newer drugs too, but newer versions of gene therapy. So I talk to my patient, and I will say this to you. Every single doctor you see that is a sickle cell specialist needs to tell you about all the options. Even if you don't want to, but they should tell you. There are 4 good therapies, there's 2 gene therapies, to tell me they gotta go somewhere. Now, I tell my patients, okay, these are my 4 good therapies, these are gene therapy. I am going to group you into 1 of 3 categories. 1, you have so many risk issues, I gotta do this gene therapy. I'm willing to take the risk. And I have one of my patients who he's 16, he had been amazing up until about 14 and a half. He started having a lot of pain crisis. He had 2 acute chests, once the intensive care unit was one of those acute chests. I'm worried about it. So I talked to him, we had one conversation. We talked about he's going to go on to gene therapy. He's going to do it. And it's not a light conversation, it's a long conversation. Another thing I didn't bring up, which is a reality too, chemotherapy causes infertility. 95% rate of infertility. Not a light discussion. It's an important discussion. In sperm making and egg harvesting is expensive. It's supported. We can get support. We got support for 2 years. What happens after? Well, I'll get to that, but it's still a part of it. The second group is I tell my patients, I love to give you this gene therapy. It is a near cure. I need to get you out of the situation if I can. But you're young. You're 16. I'm going to give myself a couple more years. Let's see what better gene therapies coming. And there are. And I'm not promoting any one type of other new gene therapy. But for example, if you want to shoot for the moon, there's a new gene therapy that's looking at doing this without chemo. It's called antibody-based conditioning. It would be amazing. It's way too early to say it's going to work. But if they can figure that out, then the doors open. There was another, it was just presented a couple days ago. There was a new version of gene therapy that was pretty much a cure. It's still chemo. Hemoglobin normalized. So there's more stuff coming. So most of my patients fall into tonight. Right? In my last category, there are a handful, there's a fair number of my patients who do just fine on hydroxyurea, oxbrida, whatever name I got them on. And I'll just let them go for a bit. And again, it's not where I want to go forever, but for a period of time. Okay, so I have gone into transition. And again, I wanted you to learn a little bit about sickle cell and how I talk to them, because when you educate your patients and family, you need to talk in a way that it translates. You want to make sure that they understand what you're saying. And I really am thankful to be able to be here, because I want to empower each of you in the way that I feel like my job is to have you. Our job is over, and that's what we're all here in the room today. We're here because we want to pay it forward. We want to make sure that we can really not only learn and educate about sickle cell, but we want to empower our community to know what to do next to make sickle cell patients support. So thank you. If it's okay, I did military time. I do it okay. Love to answer your questions. Thank you guys. Thank you.
I appreciate it so much. I was really close to him, but I saw him figured it was okay, but he's here to share lots and lots of information with us, and I want you to feel encouraged because I don't know how often we'll have the opportunity to have someone with Dr. Shaw's experience that will have this one-on-one dialogue with. So don't be shy. If there's anyone that has any questions, I'd be happy to share.
My name is Valentine Joseph, and I am the founder of JJ Foundation for Women and Children. I have 3 brothers to sickle cell. My only daughter has sickle cell. Nephews, cousins. This conversation we just had, and I'm very active. It was so refreshing. It wasn't just a slide. You were talking to me, and I'm so grateful for that. Thank you.
I heard when you came in the room here that this is your second full-time job. And so thank you for you and all the others that are doing second and third-time jobs, because we are doing this because we're passionate.
Thank you, Dr. Shaw. You know, I see a lot of people with sickle cell trait, and I hear in the medical community that sickle cell trait is asymptomatic, and there's nothing, there's nothing to worry about, they don't have the disease, and then I have people say full-blown disease. And then there's just these communications that I'm not in your field, I don't have the experience that you do, but I hear certain things that cause me to pause. And often, when I see people with sickle cell trait, depending on the number of sickle cells that they have, they experience anemia, they experience the, so many things. Can you speak to that, Dr. Shaw?
Yeah, so it brings up 2 things I think are really good to highlight. So one, it resonated with me about the trait not being known. So let's just talk numbers very briefly, just from a numbers standpoint. It's 1 in 365 Black and African Americans in the United States have sickle cell disease. 1 in 13 to 1 in 11, depending on the state, Black African Americans have the trait. So almost 1 in 10 have the trait. That's a lot. And so it is actually well recognized that we should be. Whenever I have my patients in my clinic, I always ask about those siblings. Do you know about the siblings? Do they have trait? Because they need to remember that they have trait. And the biggest gap is those teenage years. Everything is forgotten in the teenage years. And that is a critical time, because that's when they're starting to mix and learn about those girlfriends and boyfriends. And so it's harder, but you want to know. It's easier conversation technically when they have a sibling that has sickle cell. It's a little bit harder when you have a teenager trying to figure themselves out in life. They're exploring, they're wanting to at least have it. To answer your question, sickle cell trait does vary a little bit. Most patients, the vast majority of trait patients don't usually have issues outside of major stress, dehydration, being in Denver, Colorado, high altitude. So there's significant situation, bad infection. The reserves are lower, meaning you get the flu, you get COVID, you get knocked down pretty hard. You don't get infected. There are some kidney issues you potentially have, and so you should see a doctor that you can follow. Well, the second thing I think you brought up, I wanted to make sure it was a good opportunity here, is, and it was brought up too, there's different types of sickle cell, and I heard full-blown sickle cell a couple of times now. I ran a panel a couple of years ago to try and understand what would make a patient considered severe versus someone who's not severe. One thing I got out of it, I had a bunch of experts in the room, from pediatricians to family doctors to sickle cell doctors to patients. We all came to the consensus that we don't like the language severe sickle cell. Well, the reason is every patient with sickle cell can be severe. At any given moment, they can go into the wrong direction quickly. So by labeling someone as severe, or probably even more so, if I label someone as mild, because they got sickle, they got that, or even SC, if I label them as mild, that's a bad connotation, because they can still have severe complication. And then they're going to go to the emergency room and says, oh, it sounds here, you got mild sickle cell. don't put that label on a patient. I want a family to have to overcome that struggle. So I'm not a fan of using severity, or severe sickle cell. You have sickle cell. That's it. You have sickle cell. It can be severe at any time. I have, unfortunately, I've done this for almost 18 years. Just sickle cell. Literally, just sickle cell for 18 years. I have too many stories where patients come in, talking to me, they're joking, having fun. The next day they're in the intensive care unit with acute chest. They just turn. And again, they come in and they were with mild sickle cell coming in the door to the emergency room for pain crisis. But then they're severe the next day in the intensive care unit. You cannot label them as mild, moderate, severe. Now, we may do that academically, but I would not, I hesitate to call someone severe or mild, just because I don't want others to feel like they're not. Every patient can be.
When I started working at the foundation, one year we were having a walk. And we invited a lot of kids to come out to participate in the walk. The walk was in September, which is a very active hurricane. Every single one of them were in the hospital with crisis. And I said, how come this be? And I've never heard anything about that until you spoke about it today. I'm not a researcher, but common sense, I said, well, there's a connection here. Can you speak to that in this moment as I go back to that?
Yeah, so there's, I bring this back because I love what they do on spot. We do this because we love it and we're passionate about what we're doing. I have three things that I focus on research wise. One is new therapies in sickle cell. The second is how do I help my kids reach the adult level? And the third is using technology to help our patients. So I make mobile apps, I give them patients, I have watches of patients, I want to monitor them remotely. So we have gotten all this data to show that patients are having pain when it's about to rain. So when the barometer reading drops, the barometer is the pressure gene. The hurricane is coming through. You will see that patients with sickle cell will have no pain crisis. It's well documented. We did the study, we saw that patients in Pittsburgh had pain when it was cold. And that makes sense, temperatures make sense. But so in the early morning, at 2 a.m., they had a lot of, and start the temperature is dropping next time. So it is definitely well recognized and got pain.
So I've had the same thing.
That's right. That's right. And just to top up that with the conversation, in the Midwest, we do have a lot of patients who, in the cold times, hunker down and stay in the warm temperatures. But we even tell patients, we should say, actually, tell our teenagers who are going to school to not sit by the air conditioning. And really, it's those temperature changes that not just the barometer, but temperature changes. So if they are outside and it's cold, then they come in and it's really hot, but they sit by an air conditioner. Those temperature changes because of heat influence.
Loving the conversation and your presentation. I'm going to take up my professional happiness here at the day. I have my mom, daughter, and a son who has sickle cell trait, as well as my uncle who has sickle cell. And I love your trauma from approach where you don't focus on the pain, working with families. So I wanted to learn a little bit more in terms of what mental health therapies do you provide at your place of work that seems to be helpful for your families?
That's a great topic, and I was excited to see you on the panel and bring up this concept that mental health is a huge aspect for many reasons. I'll start with the first reason is that patients with sickle cell have a chronic disease. And so they're living their life growing up with the concept of trying to understand they have a chronic disease that's evolving and unpredictable. So there's a high rate of depression, high rate of anxiety, there's PTSD, these are all things that you are very well aware of. And there's actually a statistic that's stuck in my mind. 1 in 13 patients with sickle cell, we surveyed on the adult side, 1 in 13 have either thought of or committed or attempted suicide. And that just takes you to a point to say, I have to recognize that mental health needs to be addressed. So to answer your question, we have a psychologist in our pediatrics department. We have a psychologist who we refer to on the adult side, specifically for our sickle cell disease adult side. On the pediatric side, in transition, which is a difficult time, and I will say that one of the reasons I do this is I have to tell the story. I have to tell the story. So my very first day as a Duke faculty member, my first patient was a 21-year-old in my pediatric side, and everyone loved him. Everyone was like, oh, he's gonna stay in pediatrics forever. We love him. And then the very next patient was a 16-year-old. And you go, oh my gosh, Dr. Shine, he's doing everything he's not supposed to do. He's doing all these difficult things. He's doing drugs economic. You need to take him to the adult side now. I said, why is this subjective? Why is there no policy? Why are we not talking about what is best for the patient? Not best for our environment, or caring, but we need to take care of the patient. And we went back to this mental health, like what was causing the 16-year-old to have issues? So I advocated and got an hour-long slot for every patient I see. So all my patients I see in the weekend every side, 1 hour to see them. You know, it's not just me, the psychologist, the social worker, and a sickle cell educator that goes in there. So I think you need time to address those issues. Now, the other reason that mental health is important is that, and I tell patients this, it's very important for the adult side, some pediatric, but chronic pain is mental, it has a mental component. And the way I explain this for chronic pain, if you think about it, is if you have a patient who walks on hot coals, how the heck, I don't know why they do that, but how the heck do they do that? They do it because they regulate the nerves. They turn off the gate. The pain survivors go to the brain and say, oh my gosh, this hurts. The guy who walked on the hot coals is only doing it because he's turning off the gate. So I need to use mental health to help them learn how to turn the gate off. And there's other, besides mental health, there's non-pharmacologic management as well. We use acupuncture, we use relaxation, we use mindfulness, we use cognitive behavioral therapy, all of the above. And the last thing I would offer is the last thing I would offer is distraction is a big deal. I offer patients put in those earbuds, listen to the best thing you can ever, whatever you want to listen to, put it in, distract yourself. And I cannot tell you this happens many times. I know we all have seen this. Patients who go to the emergency room are likely distracting themselves from pain. And so then the nurse comes up and says, you know, Dr. Shaw, I saw your patient, he looked fine. As soon as I walked in the room, he pulled his earbud and started crying. But I didn't believe it. That's what the nurse is. I'm like, I told the nurse, I told them to do that. I told them to distract himself from that pain. That's the strategy. So he is in pain. Let's go back and individualize pain plan, what needs to be done. But let's also consider what are all the mental health issues that can help this patient be successful after this. I'm glad you.
I heard a rumor that whole pain scale was developed when a caregiver was working with someone with sickle cell and trying to identify their pain.
Yeah, and so the thing about it, and I'm hesitating here because it's true to a certain degree. It's a rumor, it's not just a rumor. But a pain scale, there's a FACES scale, there's a numeric 1 to 10. They're all, I think, not a full picture. And it's unfortunate that we're trying to say, oh, where are you on the scale of 1 to 10? 1 to 10 changes depending on environment, depends on what you were doing just before, it depends on your emotions, it depends on so many things. So I always try to put it in context. We're now moving towards even trial we're all talking about, not just looking at we're now focusing on what we call patient-reported outcomes. So we ask you, is this pain interfering with your activities? Is this pain interfering with your sleep? Is it being causing you to be more tired? Then often we're asking more questions, but I think it's a matter of reflection of what that pain really means.
I have a quick question during your talk here. Since sickle cell is genetic, and that number 1 out of 13 is established, should you go and get tested even though if no one in your immediate family has been diagnosed or have the traits? Because that number is really,
Yeah, I would advocate, so there are some arguments to say that to say yes. So my 2 cents is yes. I would say it's always better to have the information. The health department will do it for free. Most health department, I don't know what the state of Florida, but most, there are access to having to do that. I advocate for knowing it. It's always better to have the knowledge, but not have the information for the rest of your family, but also for yourself. I mean, as I said, sickle cell trait can be pertinent as you get older. Usually does, if you haven't had issues, that's great, but you may want to just know that should you get the flu, or should you get something, and it really hits you really hard, that you got nothing.
It's been an amazing conversation, information, presentation, and it's wonderful. I have the sickle cell trait and some of my family members have the sickle cell trait. But what comes to my mind, all of this amazing information we have when we get our kid and we take our kid to the doctor and find out that he has sickle cell, not just trait, but sickle cell. How do we corral this information? How do we say where to go? What I see, what I feel a need to be is this. The relationship needs to be more direct, more permanent, more matter of fact between the Sickle Cell Miami, the Sickle Cell County, the Sickle Cell Foundation in the school system. When we found out when we had sickle cell therapy, it was because one of my brothers had to have an operation and they did a blood test, so they said bring in all the other people. And so we went in and that's how we found out that we had this sickle cell training. We also found out that just because you don't have a disease doesn't mean you can't have an episode, but you can still have some of the painful characteristics of a person with the disease. But what I think what I'd like to see is people knowing what to do and where to go. So when if my name is A through H and I go to the Sickle Cell Foundation, okay, I know that they have, somebody that's gonna tell me what to do, resource wise, because the doctor said to me to contact the Sickle Cell Foundation. And if the school nurse says so-and-so, then schedule presentations, information, needs the parents, the child, like you say, children are getting of age, middle school, and what have you, need to know about the disease, whether or not they have been told they have the disease or not. We've got to have a more direct contact, partnership, relationship with the different school districts, with the different schools. It needs to be there, and it needs to be more permanent, more matter of fact, and it's something that we have to champion so that our kids, so that our parents, so that our community get all of this wonderful information and know where to go to get information. So thank you.
Thank you, Ms. Summer.
We have some representation here from the community, and you're absolutely right. I used to go into the schools years ago now, and that was not even too many places to do that, but the schools are especially important, because what I bring up is, again, talk numbers. If there's 1 in 365 patients, or 1 in 365 in the United States that have sickle cell, that's just Black and African Americans. We look at a school system. The school has 500 kids, 600 kids. It's not unusual for the school to know not to do it. They only see 1 patient. Years. So we really need to focus on schools getting that.
Thank you so much. 30 seconds. So JJ Foundation is working with the University of Miami right now. So whenever the newborn is born,
especially there's like a Haitian community here. So you also add a language barrier, social economic barrier on top of everything we just talked about, and it became just another whole world. So daycare right now, when the child is born and tested with sickle cell, we get that referral. And right now I have 25 clients that I am following up. And the trust also is there because I can share my story. They open up because what's happening was they were not returning calls to the University of Miami. So now everyone is back. And then I'm also giving them my experience, because my daughter was one of the lucky ones, had a master's degree. So again, I can work them and then they feel more comfortable. So we do have a program right now that in Palm County, I'm getting those referrals. Thank you all for the tremendous work that you're doing and take up our opportunity. Thank you. Thank you. Closing thoughts, Dr. Deb.
So I'm so grateful to be here and be a part of this journey with all of you. I'm learning alongside you, and I hope that as you go back to your homes and you go back to your families, you encourage them to accept their originality, that they find positive activities that bring them joy, whether it is the distractions of watching TV, playing video games, listening to music, or enjoying the outdoors. Remember to reach out to your political leaders, like we have Senator Robert Powell here, so you can share your voice and ignite change. Volunteer with the Sickle Cell Foundation, your community service, and help those who are struggling. And then finally, continue in purpose in all that you do, and know that when you do your check-in for your mental health, that is your wealth.
Tremendous appreciation for Dr. Walker and Dr. Walker's thoughts.
Just a quick question among your colleagues, because I've heard this discussed. Yes, the chemotherapy can cause infertility, but if you're talking to someone who's in their late 30s, early 40s and having problems, they would rather go for something that could cause infertility than not. What do you accept in your research?
Yeah, I think it's individualized, it's a shared decision. I will say that I actually, my experience, and I have a lot of patients with families to be turned away by the fact that there's infertility as a risk. It's just, they don't want it to be a forced decision, it's a shared decision, it has to be a good conversation. But it's really not that you, so that's the longer conversation, is what are the long-term risks now, right? And the last part you thought about that, gene therapy, I just want to make sure I clarify. Gene therapy is a long process. And so I saw a patient 2 ago, and he said, Dr. Shaw, I'm graduating in May, I'm going on a cruise in June, I want my gene therapy in July, I'm going to call it off. He said, look, we always say we talk about this, because gene therapy is like almost a year-long process. But just to get you ready for it, it takes about 6 to 9 weeks. Because of transfusions and all this harvest, and there's a lot to do. And then there's the procedure, and then there's the problem. So it's a long process. It's not a one and this one and done per se, but it's not a just here's the pill done. Yeah, no, and respectfully, I completely agree. Money is not. When I think about therapies, I'm not doing about it. Yeah, no, I get it. And so one of the therapies, $3.1 million, $2.2 million standard bone marrow transplant costs $1.5 million. My patient that I just referred is Medicaid. Medicaid understands that did not actually one of my most recent publications was doing cost analysis. What it costs to have sickle cell, not just the disease, but what it takes for your family to take care of it, what it takes for the loss of being able to work a full-time job. So there's a lot of perks that people don't calculate. So I think it's good.
So, last week I went to a symposium, Sickle Cell Symposium, this myself. And I come to find out that our sickle cell community, we don't work. You know, and there are other organizations that open up organizations, and they become world, they laws around. And I would like to see our organization come together in numbers where we demand what we need for our community. community and our world of sickle cell.
100%. Thank you so very much. Ladies and gentlemen, if you have final thoughts.
My final thought is continue to show that we need to move in the right direction. We're moving there. We have a ways to go. We need to work together. We need to work together in the recognition that we want to work together will carry us a long way. So continue to learn, continue to educate, continue to empower. Do those three things, and we will move, we will not. Thank you guys.